What's up, runners? So, I'm Dr. Ray Peralta here, a doctor of physical therapy and run coach. And I have almost 10 years of experience. I'm going to share how I help runners overcome patellofemoral pain syndrome, PFPS, also known as runner's knee. So, running has a way of weaving ourselves into identities, right? It's not just about the miles, it's about freedom, achievement, and pushing boundaries. But what happens when that freedom is overshadowed by pain? For many runners, patellofemoral pain syndrome, commonly called runner's knee, brings their love of the sport to a frustrating halt. Having battled these challenges alongside countless athletes, I've learned that PFPS doesn't have to be the end of your running story. With the right understanding, care, and a tailored plan, you can work through the pain and come back stronger. This guide is my way of sharing insights in how I help runners overcome PFPS, patellofemoral pain syndrome, from identifying its causes to treating it effectively. So what is PFPS? Patellofemoral pain syndrome is an umbrella term for pain related to kneecap or patella pain surrounding structures such as the cartilage, ligaments, or tendon. The symptoms can vary, but some classic signs include pain around or beneath the kneecap during or after running, difficulty walking up or down stairs, knee discomfort after sitting for long periods, and pain when kneeling. See, PFPS is responsible for nearly 25% of all running injuries, and the condition tends to linger. Research highlights that 70 to 90% of individuals with PFPS experience chronic or recurrent symptoms. Unfortunately, identifying the precise cause of knee pain can be complex, as issues in nearby structures or even the spine may contribute. About 25% of knee pain is actually caused by the spine, even though you may not have radiating pain or like sciatica type pain. The low back can actually cause like 25% of knee pain. It's pretty wild. Here's the hopeful part. PFPS is not a dead end. It's a puzzle waiting to be solved. And once you uncover the key factors driving the pain, you're already on the path to recovery. So understanding causes of PFPS. At its core, patellofemoral pain syndrome arises when imbalances or stress overloads the patella. For runners, multiple factors can contribute to this. There's gender differences in the risk factors. Women, for instance, are more prone to PFPS due to their wider set pelvis, which creates a greater Q angle, the angle between the hip and the knee, when their foot hits the ground when landing. This increased stress on the inside of the knee, combined with hip drop, causes the knock-knee phenomenon, a landing pattern called knee valgus, dynamic knee valgus, where the knee kind of buckles in, and this can compound the problem. The other issue is weak hips and core. No matter your gender, weak glute and core muscles often play a central role. Your glute max and medius stabilize your hips with every stride, countering the excessive force that lead to painful wear and tear on the knees. If those muscles aren't firing properly, the compensatory forces increase dramatically that you could be placing on your body. For example, when we're running, people think of running as just a straight ahead sport. When you're just thinking of like classical running, I'm not talking about cutting sports like soccer or basketball. I'm just talking about just pure straight ahead running, straight away running. There's still some lateral forces, a little bit of side forces that go through your body and rotational forces, which causes normally it's about just 10 to 15% of your body weight to increase, right? So, but if your body has some imbalances, maybe in your hips or in your core, that goes up to 2 to 3 times the normal body weight. So, for example, if you're a 150-pound runner, that's anywhere from 300 to 450 pounds of lateral force, abnormal forces that are going through your joints, including your knee with every step, when normally it's just like 15 pounds of force. It becomes 300 pounds of force just because there's some imbalances where the side-to-side motion gets transmitted up along the chain. They call it ground reaction forces. So also biomechanics and overstriding. So faulty run mechanics like overstriding can amplify the forces through your knees. Overstriding doesn't just increase impact. It also shifts load disproportionately to your joints. Similarly, poor foot mechanics, such as uncontrolled pronation, can cascade into knee pain. Training errors. Did you increase mileage too quickly, new surfaces, added hills too soon? Overtraining or improper ramping up intensity can predispose you to PFPS by not giving your tissues, in this case your knee, enough time to adapt. So, how I approach treating PFPS in runners. After working with hundreds of runners, I know that treating runner's knee doesn't come in a one-size-fits-all package. Instead, it's about targeting the root cause. Here's a step-by-step framework I follow to help athletes heal and return to running pain-free. So tackling training errors. First thing is load management. If you increase the mileage too quickly, I recommend scaling back and implementing a gradual build-up plan. For some, this can mean just shorter runs, but more frequent runs. Integrating walking intervals, for example, doing a run-walk program. So especially if you're dealing with pain, like your knee just hurts, instead of doing just continuous running, scale back, do run-walk. You can start with a 5-second run, 55-second walk. And if that's too little for you, you could do 10-second run, 50-second. If that's still too little, you could do 1-minute run, 2-minute walk. But you get the idea. There's different run-walk intervals. You could just pick the one that you feel most comfortable with, because you should start with just what you're comfortable with. Don't push yourself to go push through the pain, especially if this is a recurring injury. Like I mentioned before, that this patellofemoral pain syndrome can occur in keep reoccurring, month after month in like 70% of people, 70 to 90% of people with PFPS. So anyways, going back to the run walk. So again, you're just going to pick a run walk program that suits you. If you want to start very conservative, I just recommend the 5 or 10-second run and then the 55 or 50-second walk. And then you just repeat that for like a 10 or 15-minute workout. And so and then you do that 2 or 3 times a week. Other thing to do is make sure you skip downhill terrain, because downhill running tends to put a lot of force through the knee and could also worsen knee pain. And you could reduce the speed until your symptoms ease. So like the pain is less than 2 out of 10. Number 2, you also want to address tension and tightness. Tight quads, hip flexors, or hamstrings, they can amplify the stress on your kneecap. So with my athletes, my runners, I like to incorporate if I'm seeing them in person, I'm using my hands to do something called like trigger point release. It's like a type of massage technique on the soft tissue. Or I tell them, hey, go to a massage therapist if you really feel your body needs a massage. The other thing you can do is foam rolling. You can just kind of self-massage or self-release tissues with a foam roller. Foam roll your quads, your hamstrings, your calves. Both before and after your run, spend like maybe 5 or 10 minutes doing foam rolling. And that could be a great, if you have it in both knees, then obviously foam roll both legs. All the things you do is actually stretch. So I'm a big fan of the half-kneeling hip flexor stretch. And there's variations. Like you probably heard of the couch stretch, where the back leg is up against a couch or a wall. You can stretch out the hip flexor and the quad. Very important muscles to stretch because they tend to be tight, and oftentimes that tightness can contribute to patellofemoral pain syndrome, the PFPS. And there's obviously other areas you could stretch above and below the chain. So, we talked about hips. You could also stretch the ankle. You could do like calf stretches as well, improve your ankle dorsiflexion, because that could also be a factor in knee pain. Also, building strength where it matters. So strong muscles act like kind of body armor for your knees. It helps athletes reduce PFPS-related stress by strengthening key areas, for example, the quads. Exercises like long arc quads or the leg extension machine, but doing it on a single leg versus 2 legs, and Bulgarian split squats. Now, if these exercises are too hard for you, obviously you can modify them. You could decrease the range. You could do partial range or partial depth exercise. You can even modify the split squat to the standard 2-legged squat or even a wall squat. So there's different variations you can do. Hip adductors and external rotation. Moves like the lateral toe tops, monster walks, clamshell, and you can progress it or regress it. If you're like, oh, clamshell's too easy, just get a heavier band, right? You could get heavier bands to make clamshells hard. Same thing with monster walks and toe taps with a band. Core muscles, so you also want to strengthen your core. So, front plank, side plank, planks with hip abduction or hip external rotation, hip hikes, step downs, all these different core exercise variations you can do to help keep your hips level and strengthen a functional kind of approach to strengthen your core and your lower body. Correcting your biomechanics. Well, sometimes this is just the muscles, actually the way the muscles are coordinating, the sequencing, how they work together, something that physical therapists tend to call motor control. So real-time biofeedback with a coach or a physio can really help athletes improve, like their hip alignment, are they keeping their hips level as they're running, as your feet are hitting the ground, their foot strike mechanic, like, hey, maybe you have to switch from a heel strike to a midfoot or forefoot. Cadence. So, hey, maybe your cadence is too slow. Maybe you're only doing 150 steps per minute and you have to increase the cadence to like 160, 165, 170, or even to 180 if your cadence is too low. This tailored feedback helps bridge the gap between what feels right and what actually is biomechanically efficient. Because sometimes with injury, our body starts going into what's called compensations, where we start putting more weight on one side or moving away. We're not even aware of that our body's doing. It becomes like a new ingrained movement pattern or a habit. So we have to kind of re-ingrain or teach the body the proper movement patterns. And oftentimes that helps correct the running form and decrease knee pain. So motion is medicine. For recovery and injury prevention, I encourage my runners to stay active. Long hours at a desk can stiffen the knees, hips and knees, and a few simple habits go a long way, especially if you work a desk job. A lot of us have sedentary jobs where we, commute to work in a car or train, etc. Or then you're sitting, even if you work from home, maybe you're just sitting 8 hours a day, 10 hours a day. So make sure, set a timer, set like a kitchen timer every hour or 2 hours. Move your knees frequently, alternate between bending and straightening. Right? I recommend just kind of you're in a chair, extend the knee back and forth, do that every hour, every 2 hours. You just get blood flow in the tissue. Stand up, maybe do some partial squats or stretch every hour, right? You want to get some movement. You want to break up sitting too long. And this is a big factor. The just the prolonged sitting position can actually aggravate knee pain. You're not even doing anything, but yes, sitting can aggravate knee pain. So keep the injured leg straight and elevated when sitting to reduce swelling, right? So if you're dealing with swelling, you could prop the leg up, elevate it, or if you're sitting, right, instead of sitting with the knee bent at 90 degrees, sit with the knee extended and then like prop it up on a chair or something. Cool. So taking that, it will really go a long way. And if you're not just walking enough, I know there's some runners who just run on the weekends. They call them weekend warriors. Like they'll work Monday to Friday. They'll sit at a desk, all day, every day for like 5 days a week. And then they just go for a run on the weekend, like Saturday, Sunday. But they're not getting even enough baseline walking. So I recommend getting some baseline walking throughout the day as well, especially if you don't already walk. So aim for at least 30 minutes of walking a day. And you could break this up. You could do like 10 minutes of walk in the morning, 10-minute walk in the afternoon, 10-minute walk in the evening. So you have little chunks of walking throughout the day just to get your body moving, especially if you work a sedentary desk job and you don't even get enough baseline walking. So pain management for progress. Pain can hinder progress if not addressed. Technique like patellar taping can offer temporary relief. Right, so if you need taping, you've probably heard of kinesio tapes. You put like K tape or patellar taping. If you're not sure how to use that, obviously you can work with a physical therapist or athletic trainer. They do some taping around your knee to help focus strengthening your knee. But remember, this is about pain management and just not masking the symptoms, because sometimes the tape can just be temporary and you still need to do the other things I talked about above, like the strength training, the mobility training, to really get to more long-term results. So returning to running and plan for success. One of the hardest parts is the mental toll that it can take when you're dealing with injury. But progress is possible with a strategic plan. Start slow. Once pain levels drop, let's say they're less than 3 out of 10, begin again with that shorter run-walk intervals, right? Slower runs, jogs. So if you normally, run like a 6-minute per mile pace, slow it down, go to like a 9-minute per mile pace or even a 10-minute per mile pace. Or if you're already at a 12-minute per mile pace, go into a 15-minute per mile pace. You just slow it down from what you normally do. Then gradually increase the run interval, the run walk, where you start increasing the miles. So maybe you do run walk for a mile, then do run walk for 2 miles, and run walk for 3 miles, and so forth, until your desired distance. Maybe you want to do 10Ks or half marathon or even full marathon. But start slow and then slowly build up. And then once the pain's no longer an issue, it's like a minimal pain or discomfort, you go back to like a marathon training block if marathons is your thing. So respect recovery. Listen to your body. If pain spikes, adjust accordingly. Whether that means extra rest, maybe you need another day or two of resting, or maybe more sleep. Sometimes people just don't get sleep enough. Like maybe you sleep 6 hours a night, maybe you need 7 or 8 hours. Cross training. And also, again, we talk about just reducing the speed. Instead of always running fast and hard, especially when dealing with injury, slow that speed down. And with cross training, I'm a big fan of swimming, elliptical, biking. If your knees could tolerate some people with runners' knees, biking can aggravate it. But if your knees can tolerate biking and it doesn't aggravate it, then do biking. You could do outdoor biking, cycling, or indoor stationary bike. Also focus on your form, your mechanics. Maybe monitor your stride length. Make sure you're avoiding excessive overstriding where that foot's reaching too far in front of your body, and aim for a shorter cadence, faster cadence, and maybe a midfoot strike to ease the load on your knees if you need it. But if you're not sure, work with a physical therapist, especially one who works with runners, someone like myself. So you're in control of your comeback. PFPS might feel like a roadblock today, but it doesn't have to define your entire running story. With the right approach, you'll come back stronger, not just physically, but mentally as well. Remember, this process is about progress, not perfection. Each small improvement in strength, alignment, or mind is a step towards your goals. If you're feeling stuck in recovery and want personalized guidance to overcome runner's knees, I'd love to help. Together, we'll chart a plan to get you back on track, pain-free, and thriving. So start your comeback today. If you want more information, join my free course for running pain-free, a link in the show notes. Anyways, have a good day.